Tingling, burning, numbness. Feeling like you're walking on broken glass. Sound familiar? 1 in 4 people over 70 lives with this. And here's the thing most people get wrong. They look for a pill. But researchers at the University of Utah proved that the right exercises actually regrow nerve fibers. They could see it under a microscope, on skin biopsies. Today, I'm going to show you 6 simple home exercises that do exactly that. You don't need a gym, just a chair and 15 minutes a day. Your peripheral nerves are like cables running from your spinal cord down to your feet and toes. They carry signals, pain, temperature, the sense of where your body is in space. When those cables get damaged, the signal gets scrambled. Your brain gets noise instead of information. That's where the burning, tingling, and numbness come from. The number one cause is diabetes. It's behind 40% of all neuropathy cases. High blood sugar literally glues nerve proteins together through a process called glycation. But it's not just diabetes. Alcohol directly poisons nerves and blocks vitamin B1 absorption. Low vitamin B12, especially if you take metformin or omeprazole, chemotherapy, autoimmune diseases, obesity. And in 30% of cases, doctors never find the cause at all. As for supplements, I'll keep this short. The one with the strongest evidence is alpha-lipoic acid, 600 milligrams a day. A series of clinical trials called Sydney and Nathan tested it on hundreds of patients and found it reduced pain and tingling by 30 to 50%. Vitamin B12. Get your levels checked, especially if you're on metformin. And here's one that surprises people. Vitamin B6 in doses above 50 milligrams a day actually causes neuropathy. Check your supplements. All the research links are in the description below. Now, let's get to why you're really here. In 2015, scientists took skin biopsies from neuropathy patients before and after an exercise program. The nerve fibers started growing back. Not felt a little better, not seemed to improve, actual new nerve endings in the skin, visible under a microscope. Which exercises did that? I'm about to show you. Now, the actual exercises. 6 of them, 3 groups. Cardio, balance, and footwork. All at home, all with a chair. Cardio is the foundation. It's what triggered nerve regrowth in the Singleton study. Without it, the other exercises give you less benefit. The goal is 150 minutes a week. Walking, a stationary bike, swimming, whatever works for you and feels comfortable. I'll keep this brief because it's straightforward. Pick what you can do and do it regularly. But I want to show you one cardio exercise you can do at home without stepping outside. Especially useful when the weather's bad or you don't feel steady on your feet. Sit on a sturdy chair. Back straight. Don't lean into the backrest. Start lifting your knees one at a time, like you're marching in place. Add your arms. Opposite arm swings forward with each step. The pace should make your breathing pick up a little, but you can still carry on a conversation. Start with 3 minutes. Add 1 minute every few days. The goal is 10 to 15 minutes per session, twice a day. That gives you 20 to 30 minutes of cardio daily. And your risk of falling? 0. Cardio gets the healing started, but here's the problem. Damaged nerves have trouble sensing where your feet are. That's the number one reason people with neuropathy fall. The next 2 exercises could save you from a broken hip, literally. Neuropathy messes with something called proprioception, your body's sense of where it is in space. You can't feel the floor under your feet as well as you used to. Your brain doesn't get enough information to correct your balance in time. The result? Falls. And for someone over 60, a fall often means a fracture, surgery, and months of lost mobility. Stand behind a chair, both hands on the back of it. Shift your weight onto your right foot. Lift your left foot just slightly, barely an inch off the floor. That's it. Hold. The goal is 30 seconds on each leg. But if you can only manage 5 seconds right now, that's perfectly fine. Start there. 3 rounds on each side. When 30 seconds gets easy, take one hand off the chair, then both hands. And when that feels comfortable, close your eyes. That's where the magic happens. With your eyes closed, you take away your visual safety net. Your body is forced to rely on exactly those nerve pathways that are damaged, and they start working harder. It's like making a weak muscle lift weight. It's tough, but it gets stronger. Don't rush it. You'll notice a difference within 2 weeks of daily practice. Stand with your feet shoulder width apart, one hand on the chair. Slowly shift your weight back onto your heels. Your toes come up just slightly. Hold for a second. Then smoothly roll forward onto your toes. Your heels lift off the floor. Hold. And back again. 15 repetitions, 2 sets. Keep the pace slow. This isn't about speed, it's about control. Every single rock sends a signal from your feet to your brain. I'm here. I can feel the floor. I'm in control. This exercise does 3 things at once: trains your balance, strengthens your calf muscles, and stimulates the sensory receptors in the soles of your feet. 3 for the price of 1. These 2 exercises, the single leg stand and the rocks, take 5 minutes. Do them every day. In the morning, while the coffee's brewing. Balance protects you from falls. But there's something else going on. With neuropathy, the small muscles in your feet are quietly wasting away. The motor nerves stop talking to them. The next 3 exercises literally wake up the nerve endings in your feet. Exercise 4. Calf raises at a chair. Stand holding the back of a chair. Slowly rise up onto your toes. Count 1, 2 at the top, then slowly lower back down. Count 1, 2 at the bottom. Don't let your heels drop. Lower them gently. 12 repetitions, 2 sets. Rest 30 seconds between sets. Why does this matter specifically for neuropathy? 2 reasons. First, you're strengthening your calf muscles. They work like a pump. When they contract, they push blood up through your veins. When they relax, fresh blood flows down to your feet. More blood means more oxygen for your nerves. Second, every rise and drop sends a proprioceptive signal from your feet through your spinal cord to your brain. You're training the entire nerve pathway, from sole to skull. When 12 reps feel easy, try it on one leg. That's a big step up, so don't rush. Exercise 5. Towel scrunches. Sit in a chair. Lay a thin towel flat on the floor in front of you. Place your bare foot on the edge of it. Now, using only your toes, scrunch the towel toward you. Spread your toes, grab the fabric, squeeze, pull. Spread, grab, squeeze, pull. 10 times on each foot. 2 sets. At first, it'll feel like your toes aren't listening. That's completely normal. That feeling is actually the point. You're activating nerve muscle pathways that haven't been used in a long time. Every session, it gets a little easier. Your brain is literally relearning how to control these muscles through whatever nerve fibers are still working. Want to make it harder? Instead of a towel, pick up small objects with your toes. Marbles, pencils, coins. Move them from one pile to another. That's fine motor control for your feet, the advanced version. Exercise 6. Ankle circles and the alphabet. Sit down, lift one foot slightly off the floor. Rotate your foot in a circle, 10 times one way, 10 times the other. Slowly, with as much range of motion as you can. Feel the ankle joint moving through its full range. Now, the fun part. With the tip of your big toe, write the letters of the alphabet in the air. A, B, C. Take your time. Each letter is a different path that works the muscles of your lower leg and foot from a different angle. So there you have it, 6 simple exercises. Now let's turn them into an easy daily routine. Not some complicated program you need to write down, just a habit that's easy to remember. Every day, 15 minutes, 3 parts. Part 1, warm-up. Seated march, 5 to 10 minutes. That's your cardio base. Your breathing picks up, blood starts moving, your nerves start getting oxygen. Part 2, balance. Single leg stand, 30 seconds each side, 3 rounds. Heel to toe rocks, 15 reps, 2 sets. About 3 to 4 minutes total. Part 3, feet. Calf raises, 12 reps, 2 sets. Towel scrunches, 10 per foot. Circles or alphabet, 10 each way per foot. About 4 to 5 minutes total. And whenever you can and the weather's nice, a walk outside. 20 to 30 minutes, easy pace. That adds to the benefit but doesn't replace your home routine. 3 rules that make this work. First, start at half. If it says 12 reps, do 6. If it says 30 seconds, start with 10. Nerves don't like being shocked. They like gradual. Add a little more each week. Second, every single day. Consistency beats intensity. 15 minutes daily is better than an hour once a week. Nerves heal slowly, but steady effort keeps the process going. Third, check your feet after every session. Blisters, red spots, small cuts. When you can't feel pain well, damage can happen without you knowing. 1 minute of looking, and you're safe. Science has shown that nerves can regrow. We're not guessing here. So this isn't hype, and it's not just a nice idea. It's something real. And that's exactly why these 6 exercises matter. Because all it takes is a chair, 15 minutes a day, and doing them consistently. On top of that, get your B12 and blood sugar checked. Ask your doctor about alpha-lipoic acid. Eat fish and greens. Cut the sugar and trans fats. Neuropathy is not a death sentence, it's a challenge, and now you have a plan to meet it. If this video helped you, hit that like button. It helps other people find this information. Subscribe if you want more breakdowns like this, and drop a comment. Which of the 6 exercises are you going to try first? I read every single one. And please, talk to your doctor before you start, especially if you have foot ulcers, severe loss of feeling, or serious balance problems. All the scientific sources are in the description below.